Hey everybody, I'm Dr. Chris, and today I'm talking about the Weston Peick injury and why he is no longer racing in professional supercross. Peick has not raced since his injury in 2018, so I'm going to talk about what happened and share my thoughts as to why he is no longer racing after his crash.
Ladies and gentlemen, can I please have your attention?
Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. If you're here because you recently subscribed to my channel, then thank you for becoming a part of the intern army. Welcome to my channel where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody. If you're interested in sports injuries, how they happen, and how they will affect your favorite athletes, then this right here is the channel for you. Be sure to subscribe and hit the notification bell so that you don't miss any of my content. For returning members of the intern army, welcome back. Thank you for helping me get to 58,000 subscribers. Onward and upwards to 100,000K. I'm hoping to make it happen by the end of December. Weston Peick is a professional motocross racer who finished 6th in the 2018 AMA Supercross standings in the 450 Supercross division. He was injured on November 17, 2018 on the first lap of an event at the Paris-Lille Supercross. After rounding only the first turn in the event at the Bercy Supercross, Peick was tangled up with another racer at the start of the rhythm section. Peick was knocked off balance to his right-hand side and he landed on a berm face first. Instantaneously, it was clear that he had lost consciousness as he lay flaccid on the track surface. Peick quickly received medical attention on the course. Initially, the extent of his injuries were unknown as he had landed directly onto his head on the ground. At the scene, Peick was log-rolled onto a stretcher and then taken from the track. He was transported to the local hospital where he underwent an urgent assessment and stabilization. As a result of the head, neck, and facial swelling associated with his injury, Peick was placed in an induced coma to allow the initial swelling to dissipate. He was intubated and his neck was stabilized with a cervical collar while further investigations were performed and his facial swelling resolved. Screening X-ray radiographs were used during his initial assessment to determine what injuries he had suffered. More specific radiographic imaging and CT scanning were used to further characterize the pattern of fractures that Peick had suffered in anticipation of cervical stabilization of the fractures. In a social media post, his fiancée Kelly stated that at this time, she could not recognize her then fiancé's face. Once Peick's swelling had dissipated enough to allow surgery to take place, Peick underwent 3 surgeries over a period of 2 weeks to stabilize the fractures that he had suffered in his crash. During the course of this process, 10 facial fractures were fixated with a combination of 21 plates, 4 lag screws, and bone graft used to replace bone that had been lost or too severely damaged in the injury. Because there were so many fractures present, the fractures were accessed through a bicoronal trauma flap. The trauma flap is a form of facial incision that allows the front of the face to be peeled downward off the skull, widely exposing the skull for access to the surgeon. A tracheostomy was also required for breathing support while his fractures were stabilized. This is because placement of an endotracheal breathing tube would have been problematic with so many fractures around the mouth that required fixation. The 3D CT reconstructions show the extent of the injuries that Peick suffered and the amount of work that was required for stabilization. The list of injuries included bilateral, or both side, nasal bone fractures, bilateral ZYGOMA fractures, bilateral orbital fractures, bilateral maxilla fractures, and comminuted bilateral mandible fractures. That's a lot of freaking fractures. The Lefort 3 is the worst type of facial fracture where the face can basically be pulled off the front of the skull. As a result of his crash, Peick had suffered a Lefort 3 facial fracture on steroids. The severity of his injuries speaks to the reason why his surgeries were performed in a staged fashion. Post-operative images show the extent of the incision that was required to access the laundry list of fractures. Given the manner in which he struck the ground, it is frankly amazing that he did not suffer a cervical spine injury to his neck or a more significant closed head injury. In fact, it is a minor miracle that he is alive and able to talk about his injury at all. At any rate, Weston remained in hospital in Paris for several weeks before he was eventually discharged to return home to the United States. A social media post some 10 weeks after surgery showed Weston smiling with his fiancée, showing little of the evidence of his terrible injury or the massive scar from the incision used to access his multiple fractures. For all intents and purposes, Weston looked fully recovered. He had survived a terrible accident with little, if anything, to show for it. Or had he? While visually Weston appeared to be fully healed, he had suffered an injury to his orbit, which caused a substantial loss of vision in his right eye. Although Peick had suffered bilateral orbital fractures, the fracture on his right side proved to be more problematic. Complications that can be associated with repair of an orbital fracture can include blindness, double vision, globe malpositioning, infection, infraorbital nerve dysfunction, lid malpositioning, implant infection, nosebleeds, CSF leakage, or sinus disease. So clearly, orbital fractures are nothing to sneeze at. A 2018 study shows that patients with multiple fractures that undergo an orbital floor repair risk a 6.5% chance of suffering blinding surgical complications. There is no information to show what extent of vision loss had occurred in his right eye, but we can assume that it was substantial since it prevented his return to racing. This is understandable since complications such as blindness or double vision would lead to problems with depth perception when racing, which would make positioning himself on the track amongst other riders or obstacles extremely difficult, if not impossible. After returning home, Peick remained involved with the AMA Supercross circuit while he waited for the vision in his right eye to improve. He spent countless hours researching vision loss after orbital injury and looked for any way to expedite his recovery and improve his chances of restoring his vision. His efforts did not bear any fruit, however. Although Peick was able to ride, his vision had not improved enough to allow him to compete at the highest level of motocross racing. After 18 months of waiting and hoping, after endless consultations and many hours of researching, Peick eventually came to an extremely difficult decision. Weston Peick retired from professional racing on July 14th of 2020. He announced his retirement in a video, A New Chapter, premiered on Fly Racing's YouTube channel on that date. As authors Jason Wygant and Kellen Brower stated in an article in Racer X, Peick's journey was the underdog of underdog stories, and it is unfortunate for it to have ended so abruptly. Support what I do, join the channel on my Patreon. I will see you on the next one. As always, thanks for watching. That's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.